I'm concerned about the future of medicine. My brother is having trouble getting to see the specialist he needs to help him with his broken hip. And this reminds me of when President Obama said to just take a pill. It kind of looks like that's what we're doing today.
She's 105 now, over 105, but at 100, the doctor had said to her, I can't do anything more unless you have a pacemaker. I said go for it, she said go for it, but the arrhythmia specialist said, no, it's too old. Her doctor said, I'm going to make an appointment because a picture is worth 1,000 words. And when the other arrhythmia specialist saw her joy of life and so on, he said, I'm going for it. So that was over 5 years ago. My question to you is, outside the medical criteria for prolonging life for somebody who is elderly, is there any consideration that can be given for a certain spirit, a certain joy of living, quality of life, or is it just a medical cutoff at a certain age?
And we're not going to solve every difficult problem in terms of end-of-life care. A lot of that is going to have to be we as a culture and as a society starting to make better decisions within our own families and for ourselves. But what we can do is make sure that at least some of the waste that exists in the system that's not making anybody's mom better, that is loading up on additional tests or additional drugs that the evidence shows is not necessarily going to improve care, that at least we can let doctors know and your mom know that, you know what, maybe this isn't going to help. Maybe you're better off not having the surgery, but taking the painkiller, but taking the painkiller, but taking the painkiller.
About 6 years ago, I had an urgent call from a very concerned family member of a patient of mine. The patient was 94 years old, but a very active and vibrant 94-year-old lady. She lived alone, she went on vacation with her family, and they were a very devoted family and interacted constantly. And she was very smart and very quick-witted. And the daughter called me with tears in her voice, saying that her mother was being sent home to die by the physicians at a hospital who told her that she was too old. As it turns out, the woman had been complaining of severe pain in her abdomen every time she ate, to the point where she was afraid of eating and couldn't even eat anymore and was losing weight. She had gone to the emergency room 3 or 4 times over a period of 2 or 3 months because of this, and had numerous tests done, but had never come up with a conclusion as to what was causing her symptoms. Finally, the emergency room physicians had done a CAT scan angiogram of her abdomen and found that her abdominal aorta was heavily calcified and all 3 arteries to her intestines were essentially completely blocked. They told her that she was too old to have surgery and that there was nothing more that could be done. And they recommended her to take morphine and go home and die. And that's what they told the daughter. When the daughter called me and told me this, I said, well, did they tell you how she was going to die? She said, well, yes. I said, did they tell you that she was going to have severe pain until she actually infarcted her intestine and a hole opened up and spilled contents into her abdominal cavity, and she would develop horrible peritonitis and die a slow, painful death? She said, yes, that's what they told me. And I said, and did they tell you that the medicines would actually accelerate that process? And she said, no, they didn't tell me that. I said, well, bring me the films. So they brought the films, and I took a look at them and saw that 2 of her 3 arteries were completely occluded, but the third one had a very small channel, about a 90%, 95% blockage. And I knew that if I could get a thin wire across that blockage, that I would be able to sneak a stent in there and stent that artery open. And that would relieve her intestinal angina. So I discussed it with them, and I was unfortunately too busy to do it myself. I sent her to my mentor up at Stanford, And after discussing with him, he said he would talk to the family and the patient first, and if everything was okay, that he would be willing to do it. So they traveled to Stanford, and she had the procedure done the following day under local anesthesia, and was sitting up that night, eating dinner, laughing and joking, and went home the next day. And ever since that time, 6 years ago, she's been again returned to a very happy, vibrant lifestyle, going on vacations with her family, and going to the casinos and gambling, and just having a great life. And it just makes me think that these decisions must be left in the hands of patients, their families, and their caring physicians. And no politician should have the right to determine who lives and who dies.